We have with us Pete Adams, who is the author of Shattering the Illusion of Disease, along with several other books. Pete, how are you today?
Outstanding, Eric. Great to be on your show.
Absolutely. Well, I'm really honored to have you here, and I love your work and all the things that you impart to people in a time where these kind of things are needed more than ever, I would say. Pete, we're here to talk about your new book, Shattering the Illusion of Disease. Tell us about what really got you motivated to write that book in the first place. I mean, you came from a background in traditional healthcare, in the financial aspect of it, and you saw some things. But tell us about what was the inspiration for you to really write this book?
Absolutely, I'd love to. The like we had talked about before, I actually spent 6 years working on the business side of healthcare, and I was really disillusioned with it because the more I learned about the financial side, the more I realized that healthcare it's just really big business, and it to me it was just like it was all about the money, and that was it. It's like it wasn't about really healing people, helping people. It was about maximizing the bottom line as far as profit goes. And after leaving healthcare, it was always one of these things that I wish what was the best way to explain to regular people, what's going on in our healthcare system. And what happened actually about a year ago, Eric, I was down in Florida, and I had essentially this intuitive knowing where basically it came in from spirit that the disease is actually just something we create through our fears, beliefs, thoughts, and emotions. And we attach to our experience as an illness, which is, it's not even real. And what happens is through our thoughts and beliefs, and fears going the wrong way, we create the illusion of ill health, and then we spend our time trying to fight it when all we really need to do is use our minds to uncreate what we created through the misuse of our thought.
Right. When you were in healthcare, you were in the finance aspect of it at that point?
Yes, I was a director of finance for a practice management company, which oversaw independent physician associations. And basically, we were doing the back office work for them. And then later on, I went to work as a decision support analyst for a very large hospital corporation, actually the largest for-profit one in the United States. And, from my experience of 6 years, actually a little bit more than 6 years in that industry, I really got an insider scoop as far as how the system really works, and basically the machine of healthcare, and what it really is. It's just totally a money machine, and it's basically just there to make enormous profits and not really heal anyone or not make anyone well, because if you make somebody if somebody gets well, they'll have to come back. Well, they stop spending money, and that's not their revenue model. What they want is recurring revenue, and essentially they want to keep you somewhere between healed and dead, because if they heal you, they lose the revenue stream, and if you pass away, well, they lose the revenue stream there as well. I know that sounds crazy pessimistic. I know that sounds like insane to people who haven't worked in healthcare, but for those of us who have worked on the business side, this is the absolute truth.
There was a pharmaceutical executive who I can't recall at the moment who said something. He was sort of a whistleblower, and he said something along the same lines, and it's not an exact quote, but it's pretty close to what I remember him saying. And he said something to the effect that it's a great travesty to heal people, and it's a great travesty to kill people. So, they wanted to keep things in the middle of the road, just like you said. And that really goes a lot to talk about and emphasize what you said about the emphasis on money and just making money. There was something that you alluded to in the book, a conversation that you were privy to by a practitioner that was quite alarming, I think. Would you care to kind of retell that little episode?
Oh yeah, I'd love to, Eric. It is rather shocking. What I'm going to tell all your listeners is it is pretty shocking, and rather than just dance around it, let me just cut to the chase. And that is back when I was the director of finance for that practice management company, we had a board meeting with the group of physicians up in Pinellas County, which is in St. Petersburg, Florida. And after we had our formal board meeting, there was a separate meeting set up by an eye surgeon who wanted to talk to the CFO and myself about basically getting more compensation. He wasn't happy about what he was getting paid. He didn't feel like he was getting paid fairly. And and we told him essentially that it's we don't make those decisions. We're just the back office side, and the decisions as far as who gets paid and how much are actually made by the organization that he was part of. Well, the long story short, this is what this gentleman said to us, and this is a physician in St. Petersburg, Florida, and he said to the CFO and myself, he said, he's like, I probably would do a better job operating on your grandmother if I was happy with my compensation. And Eric, you could have heard a pin drop after he said that. My jaw just dropped open, and I didn't know what to say. I was just like, I couldn't believe he actually said that. I had thought that same thing before I ever heard anyone say it, and to hear a physician be that blunt about, he really didn't give a care about the patient. It was really about how much money he could make. And and the CFO, he was just as astonished as I was. And we left that meeting and we just drove back to our office and just kept saying, "Do you really believe you said that?" And that's that. Once that happened, Eric, I was just like, I got to get out of this industry. I mean, these people are snakes. And that's the story that actually this really happened, and I believe it was back in 1999. But and nothing's changed in healthcare. I'm sure the guy is still practicing and still whining about his level of compensation. But anyways, I'm just blessed that I'm not in that industry anymore.
Yeah, I would say you're blessed too, and thanks for getting out of it, because we need your talents doing other things than being involved with that sort of operation. It's just unbelievable.
Right.
It's in contrast to how ancient Chinese medicine used to work, and I remember an acupuncture doctor that I went to see one time talking about how in the old days in China, you would pay your physician while you're well, and then you would stop paying them when you were sick. And that was the incentive to keep people well. Quite opposite from what we have today, clearly. You also in the book go into detail about how charges are made up, with the cost of the services and this sort of thing. That I was kind of cracking up when I was reading that, but it's virtually just made up from what I understand. Is that right?
For the most part, yes, Eric. There's something called the charge master especially in hospitals, and what that is, it's essentially the ledger that has the price of every single thing or service we offer at the hospital. And one of the games that we play as the hospital, and we play the game against the insurance companies, because most insurance companies have the standard deal with the hospital or other providers, and what the standard deal is, it's called 70% of billed charges. So what that means is whatever the charges we say are due to us for these services from a patient, essentially the insurance company will pay 70% of those charges. So this is how we make money in hospital land. We just keep raising the prices of our charges. And we know that the insurance company is going to go lockstep with us. So we raise our prices, say 15%. They raise their prices 15%, so they keep their margin. And they just pass those higher costs back down to the consumer or the employee who's paying for these programs or the insurance. So it's just totally out of control, because there's nothing stopping the hospital from just keep raising their prices, because the insurance company's just going to keep raising their prices as well. And that's why you're seeing the cost of healthcare all of a sudden seem like unsustainable. And what's happening is it's because they've had their model is essentially compounded growth at 15%. So in less than 6 years, the cost of healthcare will double just as a result of the compounding effect.
Wow. And so I like to call it balance sheet medicine or BS medicine, because it's geared towards, hey, we got to increase profits, so let's raise prices. It's pretty much that simple.
Oh, it really is too. And one of the things I hope the listeners of the show realize, it's like, I am not a pessimistic person whatsoever. I am totally optimistic always. But the level of toxicity in healthcare it's actually worse than I'm explaining here totally. But everyone just needs to understand that it is truly big business. And one of the things that I used to see a lot in the hospital world was we have this idea that we're providing excellent care for our patients. We're not providing excellent care for our patients. We're just trying to do every single test, in mankind, in medicine, just to run the bill up on our patients. It's like you go in, a patient goes in there for an upset stomach, and they're doing an X-ray of the person's ankle. I mean, this is how ridiculous it is. And, I know it's I'm being a little facetious there, but this is how that stuff happens. I mean, you look at the last, fortunately, hopefully no one's had a recent hospital stay, but when you get these bills that $50,000, $60,000, $70,000, and it's all just fluff. I mean, are you kidding me? There is nothing we could do for you that should cost $70,000. I mean, that's ridiculous.
It seems like what they're doing is just putting all these tests together, procedures, everything that they could justify in order to collect the maximum amount from the, in other words, the higher the bill that they can generate, the more they're going to collect. Even if they're not collecting 100% of it, they're still going to collect a pretty good piece of it. Is that right?
Right. We're going to get 70% of everything we could possibly charge. So the incentive is run that tab up as high as possible. I mean, that is the motivation. And one of the things that you'll see with the insurance companies is, like, as soon as, let's say, you get admitted into a hospital, that is like worst case scenario for the insurance company, because now all of a sudden they lose control over with the money that's being spent. Because what the insurance companies want to do is they want to collect premiums from the people who are insured. Let's say you've got an HMO. Well, their model is collect all the premium they can and to spend as little money as possible. So now it's like, say somebody gets sick, gets admitted to the hospital. Now their model is becoming unraveled, because they realize that the cost in the hospital could wipe out the profit from any single individual or more, just because the cost is so high. So that's why you'll see a lot of times, not a lot of times, all the time, they'll assign what's called a case manager. And this is the insurance company. They're assigning a case manager to you, the patient. And the role of the case manager is to make sure the hospital spends as little money as freaking possible, because it's going to hurt the insurance company's bottom line. So it's almost this like arm wrestle match for dollars, Eric. It's when you see it in action, and it's like, it's so money driven that it's disgusting. And I've seen it firsthand for years. So I know what I'm talking about, and if anybody wants to call me on it, have at it, because I've been there, I've done it, and the system's broken.
Well, and just a little bit, of course, before we complete the interview, we're going to give all your contact information to anyone who's listening to this. They want to reach out for more resources, and also how to get copies of your book and that sort of thing. That's such a, you had a ringside seat effectively at the at this whole circus.
Oh, exactly, Eric. And it really is a circus. And one of the things that's really troubled me with the whole here in the United States, we have the Affordable Care Act, what a lot of people call Obamacare. And what really blew my mind was the fact that the insurance lobby essentially wrote that whole law, and the Congress didn't even read it. They just said, "Yeah, that's great. nirvana. And it was just like they locked in their profits at any cost. So it's just like no matter what, the insurance company and the healthcare providers are going to make a profit. There was like no risk. And that's why the friggin' premiums are like crazy high. The deductibles are insane. And it's just like, and if you don't buy into their bogus health care, at one time they wanted to fine you as a U.S. citizen. It's just, to me, it's absolutely ludicrous. The whole thing should just be dumped out because it's just a dirty tub of nasty water. And we can do so much better, but it's going to take some backbone to make it happen.
Well, and this is where people are going to be empowered, and you're going to teach people how, through your work, to be empowered to create their own health strategies. So we wanted to create a little background so people could understand what they're dealing with in the context of the system. And the context is very important, whatever you're working with or whatever situation you're involved with, understanding the context of it, which in this case is it's a profit-oriented process and model. It's not geared towards healing and solutions, and that's what people really need to understand to take control of their own health. It's essential to understand that, so you can start looking for and working on the right solutions, which you give people in your work. And back to your work, I misspoke about the title of your book. The full title is Shattering the Illusion of Disease, the 7 Steps to Reclaiming Your Perfect Health, and it's a little bit different from your first book, which was Visual Festations. Let's segue into how this book is different than the first one that you wrote, and talk to us a little bit about what your processes are about, without necessarily going into the details of each of them, just the big overview, if you could.
Sure, I'd love to, Eric. My first book, Visual Festation, I wrote that back just over 8 years ago now. And it was really about my experience and my success working with the law of attraction to essentially create miracles in my own life. And that experience from back then grew into my second book, which was called the 7 Masteries for Success with Deliberate Creation. And what I learned through that process was, we all have the ability to create our own reality, and sickness and disease is not something that has to be part of your reality. That's just an illusion that we're creating. And then I really went really into healthcare when I wrote the book Shattering the Illusion of Disease, because what came into me from spirit again was, disease was something that we're creating through the misuse of our thoughts, beliefs, and emotions and fears. And it's what's happening is, if you hold on to these negative feelings where you don't forgive people, you have resentment, well, over time, it's corrosive, and what ends up happening is, those negative thoughts do not live in your mind or your body free of charge. And what ends up happening is, over time, they're going to make you sick. You're making yourself sick by thinking these things, essentially. And it's going to show up in your experience, and it's going to attach it to your experience. So one day you wake up, you've been negative for 10 years, and then all of a sudden you've got some disease that just showed up. Well, it didn't just show up. You've been creating this illusion, of disease that you're manifesting into your experience. And although that is horrible, but it's all about personal responsibility. It's just like you created that. No one else did this to you. It's all you. But the great news is, through changing your thoughts, your beliefs, your emotions, you can make the illusion of disease go away. It can happen overnight. It can happen in a breath. Because we truly have dominion over our thoughts, and by focusing on what we desire and being grateful, and we can essentially heal anything in our experience, because it was all created through thought, and anything created through thought can be healed through thought. And that might sound a little simplistic, but that's the truth.
That's an amazing sort of realization to arrive at that you actually can create your disease state by thinking, feeling, or believing certain things, and that's going to probably come as a shock to a lot of people. The Western medicine approach certainly doesn't really appreciate or investigate the holistic nature of what you're saying right there, and it's really powerful to start to think that way and to begin opening oneself to that that idea, because then you start to look in some different areas, like in your work, to help to alleviate or create a different solution to the challenges that one might be experiencing.
Right, and and that's the biggest thing too. You really just touched upon it very well. Is Western medicine it really doesn't go to the core of what created this illusion or what this manifestation of disease. It's always like, well, how do we fight it now, rather than, well, how can we make sure this never happens? And I think that is the biggest thing. It's like, if we can teach people to watch what they think, watch what they believe on a daily basis, they're gonna everyone's gonna be so much more healthy. And it's just it seems simplistic, but you know what? You really need to focus on what are you thinking every moment of the day, because what you cannot do is you cannot be like everyone else. Everyone else pretty much has it wrong. They're all talking about going to the next doctor's appointment, all this nonsense, and that's what most people in the developed world believe. They believe like somehow disease happened to them. They had nothing to do with it, so there's no responsibility. And now it's just like, go to the doctor and hopefully get fixed. Well, that's not how it works at all. You create, each of us, if we do have the experience of disease in our experience at this moment, or we have had it in the past, it's all us. It's all our responsibility. And a lot of people don't want to take responsibility. Well, I could never be responsible. Why would I ever do this to myself? Well, you did it to yourself without even realizing you were doing it, and you did it automatically just because you weren't paying attention to the thoughts you were thinking on a daily basis, and you never believed that thinking negative thoughts would have any kind of negative outcome in your experience. And that's just not how it is either. It's like your thoughts are things. They're powerful, and it's just like you can create the life of your dreams, or you can create a nightmare of your dreams, and you do it all through your thoughts.
And if your thoughts can make you ill, then your thoughts can make you well. It's a simple realization. Recently, I was having some blood drawn for a test, and as kind of a parlor trick, they were taking blood pressure, and I had very healthy blood pressure at the time, and I said, "Hey, you want to see something interesting?" And I asked him to recuff me, and I sat there and I just changed my emotional state and thoughts, and I completely blew the mind of the guy sitting there taking the blood pressure, because he looked at it. He was like, "Oh my God! If I saw this the first time, I would have called an ambulance, because this is absolutely atrocious blood pressure." And he showed one of his colleagues, and they all had a nice laugh about it. But the point, and I did that just to illustrate that point, because he's a person that actually believes this kind of stuff too. I illustrate that point to him, and it's true. You once you begin to apprehend your thoughts and realize what they're doing to you, then you can start making them work in your favor. And your book really talks about that and goes into much more detail. You mentioned also in your book about how sometimes people are trying to feel love, and they wind up manifesting ill health. Can you touch on that theme as well?
Ooh, absolutely, Eric. That's something that's like so powerful that I've seen in numerous situations over my 50+ years on the planet. And a lot of times, what happens is people go back to their childhood. As a child, everyone wants to feel love and attention. And unfortunately, a lot of times, like let's say when you're a little kid, let's say you fall down, you get hurt. well, your mother or your dad comes over, or somebody comes over, picks you up, and gives you a hug, and you feel love. Well, what ends up happening is subconsciously, people start making this connection where if I'm sick, I feel love. So it's almost like, look at some of the people that you might have around. This goes to everyone on listening to the show. Look around at different people that you have in your life. And there's some people you'll notice, they're sick all the time. And what happens is, when they do get sick, they get attention. So everyone's like asking, well, how's the battle against whatever going? And it's like, oh, it's not so good. I mean, it's essentially people are making themselves sick on. I know it's going to sound awful. They're making themselves sick on purpose. It's showing up in their reality because, in a perverse way, the sicker they get, the more attention they get from others, and the more love that they feel. The scary thing is, though, this can get way out of hand, and before you know it, you're dead because of your obsession to feel love, and by using the wrong vehicle to feel love, would be that being creating this disease and attaching it to your experience, so you're subconsciously you can feel more love. I just look around. You see it in your everyday experience. And the people who are caught in that loop, they don't even realize they're doing it. So it's
being done on purpose at some level, not necessarily at the conscious level. And that's probably important for people to, because some people hear that the wrong way and say, well, I'm not making myself sick. And not consciously, certainly.
Thank you, Eric. Yeah, not consciously, but unconsciously, the subconscious is running this program, and they think they just have bad health. No, they're not bad health. They've got a bad idea on how to feel love. So and that's the most powerful emotion that we have, and used the wrong way, it can be the most dangerous weapon that we have against ourselves.
You also talk in the book about how these disease awareness groups actually increase the level of disease, and I thought that was a brilliant observation. Touch on that as well, if you would.
Ooh, absolutely, Eric. What it really comes down to, it's like wherever your attention goes and your focus goes, that's where your energy goes, and what you focus on becomes more powerful. And one of the things that I find super troubling is almost every horrible disease that we have, we believe we have, it also has like an awareness group with it. So everyone wants to, for me, being a law of attraction person and knowing that it's like whatever you focus on magnifies. And so the awareness groups have these big marches, and all they're doing is putting the focus on the disease and, and trying to be a survivor. And it's just like all it's doing is you basically have 10,000 people marching, amping up the fear that they're going to get this disease or whatever it is. And sure enough, by scaring themselves out of their wits, they get the disease. It's like it didn't happen from the outside. It all happened from the inside, and it's just like put 10,000 people together, all have them focusing on something negative. Well, nothing positive is going to come out of that. I mean, that's just how it is. It's like rather than it's almost like give all your attention to the disease. Well, how about give all your attention to the healing? Take the focus off the disease, refocus on what you're thinking, and change your reality. That would be my advice.
That's huge. That's huge right there. There was a gentleman years ago that wrote some very interesting books by the name of Morris Beal, and he touched on this back in the 40s about how these big national cancer research or whatever. They had the Tuberculosis Society back then and this sort of thing. And he pointed out back in the day that these were just machines to rake in tons of money not provide a cure and to keep people, basically in, like we've talked about, kind of a disease state, but just treat them and make more money. It was never about creating solutions or finding real healing, which
yeah, right. Well, Eric, I'm glad you touched on that because I didn't mention this earlier. But all those quote unquote nonprofits, disease-based whatever, it's like the more fear they can create, the more revenue they take in, which basically means the more money that they can pay themselves to profit from this fear of this disease. So it's just like some people are getting rich, some people are getting dead. And there's no reason to have these organizations, in my personal opinion. They don't help anyone. They just make more people sick. And that's, if anyone listening to the show absolutely flat out disagrees with me, I respect your opinion. But I also have my opinion, and it's based on, years of watching healthcare, but also then having, been privy to spiritual truths. So it's like I'm coming from a different spot than a lot of other people are. But if you think through this stuff and listen to what Eric just said about the other gentleman, we're not making this stuff up. People have been talking about this for over 75 years, and the Eastern medicine and all these holistic ways to heal ourselves and one another, they just kind of get swept under the rug as being hocus pocus. Well, you want hocus pocus? Go try Western medicine. It's just like, it's at best, it's gambling. I mean, they have no idea what they're doing, and that's the truth. It's really just about how much money can we make, and nothing else really matters.
Well, and then it's even worse than that, because these societies and organizations, as Morris had pointed out, are actually set up to make sure people don't have access to the quick and easy cures that may be available, and it's to keep people away from them and keep them in treatment mode for perpetuity, effectively.
Exactly. And Eric, I know you're a super healthy eater, and and the amount of issues that people have that they can get rid of just by changing their diet is incredible. But then again, there's the pharmaceutical companies do not make any money if you start eating healthy. They would rather have you have type 2 diabetes so they can give you a drug for the rest of the time.
Right. Well, that's a whole other discussion about how the food industry and the pharmaceutical industries are closely tied together, and how they feed off of each other in a huge way. You talk in your book also about miraculous healings, and part of that is, as you've already talked about, apprehending your words and thoughts and using them intentionally. But tell us about some of the miraculous healings that you've witnessed or been a party to, and I think there was even a lady that had asked for your help in coaching her along how to help her sick, was it granddaughter, I think?
Yes, it was actually. Yeah, it was. I think it was back in 2012. I wrote a small ebook called "The Visual Manifestation Guide to Healing," and that came about as from a conversation I had with a lady who had read my book, and she approached me, and she told me that her granddaughter had just been diagnosed with leukemia, and she was about 9 years old. And the lady, approached me and asked me, what could I do to help her granddaughter? And quite frankly, I was just blown away. I was just, I'm in my mind, I'm thinking, I'm a law of attraction guy, and I've got this woman who's entrusting me with her, essentially to help heal her granddaughter. And I was just like, I almost wanted to lay down because I was just like, whoa, this is a lot. And so what I did was I told the grandma, I said, I've been thinking about doing something like this. So I'll work on a book for your granddaughter. So I did. And then what was wonderful was I want to say about a year later, I was going through my office, just cleaning off my desk, trying to get organized, and I came across a scrap of paper, and it had the grandmother's phone number and her email address on this. And I'm like, wow, I haven't followed up with these people. Let's see what's going on. So essentially, I sent the grandmother an email, and she came back like a few seconds later, and she told me that her granddaughter Sandy had a full and essentially a miraculous healing, and she was going back to school in the fall as a happy and healthy 10-year-old. And Eric, let me tell you, it made me cry. It was awesome. And
I was going to say that had to make you feel amazing too. At least part of the guiding conversation with that. That's amazing.
It's like it's just even thinking about it is emotional now. It was awesome. But there was another story I want to share with all your listeners, and this came to me firsthand. This is not somebody who read my book and had this healing. This is something from a lady who had read my. This is before I wrote Shatter the Illusion. Well, to cut to the chase, this lady met my wife and I for lunch, and she told us the story about her healing. And this is just so over the top, Eric. I'm just going to jump in. And this lady, she was around 40 years old, and she had been abused when she was a kid, and so she had massive resentment. Felt guilty. All these horrible emotions that she carried with her since she was a young girl. And what ended up happening is these negative emotions ended up making her sick to the point where she was in hospice. And she was in hospice in Florida. And they're basically just waiting for her to die. And she's only 40 years old. And then what happened for her was something came over her and just said, enough is enough. This is you're healed. Get out of here. And she was just like, she knew it was the truth. It was just that clear to her. So she told the people at hospice, I'm healed. Let me out of here. And they wouldn't let her go. I mean, they're like, oh, you're crazy. You're dying. Trust us. Well, she wouldn't take no for an answer. And she finally got herself the hell out of there. And she was like, on death's doorstep. And then she just had this miraculous healing and was never sick again, as far as I know. And it was just like so powerful to me that what your mind can do to you when you don't control your thoughts, it'll create chaos in your experience to the point where you don't want to be 40 years old and be in hospice and everyone's just like hanging out waiting for you to die. I mean, that's pretty gruesome, in my mind. But the fact that this woman, in a flash of light, had a miraculous healing, and I spoke with this woman, and this had been, this is like 5 years after that had happened for her. So to hear it firsthand from somebody who did it, I know I'm relaying secondhand information to all the listeners, but I met this woman and I'm just relaying her story. I'm not telling you how she did it. I'm just telling you, that's what happened for her. So to anyone out there who, gosh, I hope not, is in a similar situation, well, don't believe for a second you can't have a miraculous healing yourself, because you can.
Well, someone once said, as you believe, so shall it be done unto you. So you have to believe first, and then you see second. You got to believe it to see it.
Right,
exactly. Sounds opposite from what we're told.
No. Oh, yeah. Well, anyone who says, I'll believe it when I see it, well, I got news for you. You're never going to see it because you don't believe it. And that is so true, Eric. It's just the truth. It's not. If you don't believe you can be healed, well, guess what? All the drugs in the world or whatever are not going to heal you because you don't believe it. So it's like, if you don't believe you can be healed, nothing is going to change until you change that fundamental belief.
It's interesting you say that. Bernie Siegel had written a book called Love, Medicine, and Miracles years ago, and he said that very plainly in his book. And he's a Harvard-trained MD, and he said the patient's greatest source of healing is their belief in whatever it is that they're doing to get the healing. And that was probably written at a time when medicine may not have been quite as offensive as it is now. But nevertheless, the ultimate tagline here is that you've got to become responsible for your own health and responsible for your own healing, and your work teaches people how to do that. What's the first step people need to take when they're on the road to making a shift into, being healthy from some other state?
My formula, the first thing for me, Eric, is, people need to decide that they're going to have perfect health. And it's just, until you make the decision, nothing is going to change, because you're kind of just bopping along the bottom like, something in a river. But until you make the conscious decision to, I am going to take responsibility for my health, that's the first step to becoming healthy, because you've got to take charge of your own health, and you've got to take charge of your own beliefs. No one can do this for you. It's like the doctor can't do it for you, your family can't do it for you. You have to do it for yourself.
And then that leads to the actions that one would take. Literally, just this week, I was listening to a story of a gentleman who years ago had, while he was at work, something really bad happened to him, and he was told by doctors he would never regain the use of his left arm. And he basically just said, I don't accept that. I refuse that diagnosis. I refuse that prognosis. And he went home and made his own apparatus at home to do his own physical therapy and regained 100% of his left arm use. And it comes from that point of just that decision point. And it's powerful.
Oh, absolutely. It's like, and that's one of the biggest things I want to tell people. It's just like, don't believe a thing you hear. Because Eric, you and I have talked about this before, where, a physician will come out and they'll just basically tell somebody, you've got 3 weeks to live, go home, get your affairs in order. You're toast. And do not believe that for a second. It's like, who is this person? Are they God? No. Well, and unless you give them the power over your beliefs, and you can do this, but if you give them your power, I can tell you this: in 3 weeks' time, you're probably going to be dead because you bought into their BS. So it's like, you hear anything negative, just like this gentleman who had the injured arm. It's like, yeah, whatever. Just, that's their reality. It's not your reality unless you decide to make it your reality. And, choose the reality of health, peace, and abundance, and heal yourself. It's you can do this. It's completely up to you. But like Eric said, it comes down to beliefs. You've got to believe you can do this. Or better yet, you don't need to believe you can do this, but believe that God or Spirit can do this through you, because there's nothing God can't do. So if you believe God's limited, well, that's probably another limiting belief that you need to address and move forward on.
Well, and to that end, and helping get the information, the exact processes that people can use to help themselves, tell us about where people can get a hold of your books, Pete, how they can get a hold of you, and about your website, if you would.
Oh, thank you, Eric. I'd love to. Our website is actually my name, which is Peter D. Adams, and the D is my middle initial, and it says Peter D. as in Delta Adams, and .com. So you can easily find us on the web. But more importantly, for most people, especially anyone listening to this call, who may have issues with ill health or the illusion of it right now, please visit our YouTube channel, and you can find it just by Googling the title of my first book, which is Visual Festation, and my name in YouTube, and you pull our channel right up. And all 3 of my books are there as audiobooks for free. So you don't need to wait. It's like you can just log on and listen to our books. And I hope you will, take advantage of that resource. But if you'd like to buy the books as a hard copy, all our stuff's available on Amazon.com, and you can also buy it through our website, which just pushes you through to Amazon anyway. So if you want the books in hard copy, like I said, they're on Amazon.com. If you're in a part of the world where you don't have access to, like, say, Amazon.com, you can always email me, and I'll be happy to send you the PDF version of any of my books. And my email address is visualfestation@gmail.com. So just reach out to me. If you have any questions, I'm really available for the most part, and I enjoy answering questions and helping folks. So, don't be shy. Reach out to me, and live. You came here to live the life of your dreams, and I'm just here to help you do that.
I can think of very few people, Pete, who are more intentional and loving towards people and want to help people more than you. And I'm really grateful that I know you and appreciate your work and just how much you want to get this into the hands of people. And you've got people that are using it effectively now. So if anyone's listening to this and wants to improve their situation, not just around health, because your Visual Festation book is about how to manifest anything in your life that you may want to attract. That's powerful too. So thank you so much for having this interview, and I hope anybody who's listening to this that needs to or wants to reach out to Pete through his resources. And thank you again, Pete, for being available. Really appreciate your time today.
Well, thank you for having me, Eric. It was a wonderful show, and I enjoyed it greatly.
All right, we'll be talking soon. Thanks, everybody, and anybody who's listening to this, and look forward to hearing from you. Be well, and we will all speak soon. Take care.